Doing fine. We just the good afternoon to everyone. We got Bill Jackson from the 18th Congressional District. Vice Mayor Pro Tem Martha Tatum, Councilmember Edward Power District J, and Councilmember out of District H. First, Chief Pena and Chief Rodney West is also here as well. So let me just say that the Houston Health Department today is reporting 703 new cases of COVID-19, bringing Houston's total to 32,693. Unfortunately, today we are announcing 16 people today who have died as a result of COVID-19, which brings the number to 295. This is the first time since we've been dealing with this pandemic that we have announced double digits in terms of people who have died. The highest number that we've ever reported in any daily report was 9. Today we are announcing 16. I'm not going to read each one off individually, but they are listed on the monitors next to me, in front as well as behind me. I want to acknowledge each person's death because each one represents someone's family members are listed like that. Please bear in mind that families are now experiencing their pain, the pain of their loss. 7 of the 16 were Hispanic, including a 70-year-old man and a 50-year-old female who had no underlying health conditions. 5 of the 16 were Asians. There was also included in this list a black man in his 50s and 3 white individuals who passed away from COVID-19 recently. As I've said, all does not discriminate, and it is spreading uncontrollably in our community, and it is affecting people with or without any underlying health conditions. And it is important that we work together to slow the progression of this virus. July is a very important, so we need to do everything within our power to work together to slow the progression, and we do that by wearing these masks, and I want to continue to emphasize that, engaging in social distancing and exercising proper hygiene. This superintendents of several of our school districts, and I want to commend all of them for carefully weighing the risks of opening schools during the pandemic, and they are putting the lives of their students, their teachers, above all else. Houston Independent School Districts, the state's largest school district, announced its plan for returning to school. Reconnect safely, return strong is the motto for all students who will begin the academic year virtually. And online learning will last at least through Friday, October the 16th. The district will proceed cautiously in deciding when to return to the classroom, and I want to commend Superintendent Grenita Latham for the approach that she has taken. Also, they will start on August the 6th, but they will start virtually and will remain virtually for the first 3 weeks. Aldine, for example, will start virtually on August 17th. Spring Independent School District will team, and Spring Branch will start on August 17th, and they will give their parents choices of whether to be virtual or in person. And again, they are still kind of crystallizing their plans. Let me just say that it is very important to slow the progression now in the month of July going into August, and that certainly is going to have a direct impact on what takes place in the months of August, September, and October. I am pleased to hear that Governor Abbott and the Texas Education Commissioner Mike Morat will be changing the guideline flexibility, something which is sorely needed as cases surge in Houston and Harris County. Until we get the virus under control, we must continue to wear our masks, maintain social distance, and avoid large gatherings. We need 90% compliance. Be a measurable difference in the spread of this virus. And by wearing your mask today, you are slowing the spread of COVID-19, and in 2 to 3 weeks, hopefully we'll start to see some results. At least we're going to throw everything that we have at this virus, everything that we can do locally. We intend to do everything we can do within our authority. I want to thank all of our partners, from Simone Biles to Slim Thug to Carlos Carrera to Trey the Truth, and so many others who have joined with us in encouraging people to be. Also encourage people to get tested, and if you have symptoms or have been around groups of people, please do so. I was tested just this past weekend for another time, and I'm tested on a regular basis, 2 to 3 weeks, and I'm pleased to result negative. That was only good for then. Still have to make sure that I continue to wear this mask and do engage in social distancing. The city has the 2 testing sites at Butler and Del Mar Stadium, and proud to announce FEMA will continue to be with us through the end of July. I want to thank Congresswoman Sheila Jackson-Lee and everyone else for working to make that happen. Push the envelope, but they'll be with us through July. The way things are right now, we probably need them to stay, Congresswoman, through August. I'm just putting that out right now, just saying. We have partnered with 2 other locations for free COVID-2 sites, be open at even at Willbrook Church, Fallbrook at 12,000 Wall Road in Houston. That's Fall 112 Walters Road. That's Pastor Mike. And in Southwest Houston, in District High Dimension at 9800 Club Creek, 2 additional sites will be open. Both are free. Schedule appointment at 1-697. That's 1-833-697-4839. So in addition to the free testing sites, 2 additional testing sites opening tomorrow, Fall in Northeast Houston Road, and then at the church, 900 Club Creek Drive, West Houston, full advantage of these additional testing sites. Now let me bring up Dr. Purse, Houston Health Department. Dr. Purse.
Let's start out a moment with the state commissioner, and I've worked with him, and a couple of times I want to thank both of their support and their sites and their today point out that and Houstonians can do to slow down this virus is to work with the racing that goes along with that. A graph coming up here in just a moment. Once you get it, that you will then be for those who live within the city you by this graphic represents that you will be contacted. You may recall from the number 300. That's not a number you have already labeled. You could write now on your phone and identify it as you've been tested, and you're awaiting the result from the number. You'll know who it is, a timeshare or anything along those lines. This is trying to work with you to help. You get an email, department, the graphic that it has there, survey.com, or a text. And if you get contact the text messenger by email or survey that you will, when we find the younger folks, the electronic communication, so that survey information help you in your code. In fact, it's likely first likely to apply. Talk about global first group family. The second group that you're helping most are your coworkers, followed by friends and neighbors. So again, this is the way we will reach out and try to talk to you. Mayor also spoke about the importance of wearing masks. And so with our next graphic, I want to show a recent study that was published in the CDC, the Center for Disease Control and Prevention. They have a weekly publication, mortality weekly report. For those in my line of work, this is a publication we look at very frequently. It has very timely, up-to-date information. And in the recent one, a study came out. Now, this is only one study, but it's an event. And what it was, there was a hairstylist at this hair salon who were both infected and had symptoms, but did not yet know that they were infected with COVID. And so they continued to work. So, you know, I think everyone should know that if you think you're having symptoms, you shouldn't go to work, right? So, but they went to work. Now, where they worked at that hair salon, they were quite stringent on the fact that the employees and the patrons, and that's very important. And, you know, we know in some of the businesses, places aren't being terribly strict about it. So in this case, the two stylists, over the several days between when they developed symptoms and when they found out that they were infected, worked with 139 clients. None of them came infected. Almost certainly because every single one of them wore a mask. While we're still waiting for the metrics to come out as exactly how effective a mask is, the measure on it, it's going to be very, very effective. So clearly when you're getting your hair done and you're with somebody for them, you're not 6 feet apart. So we still advocate the 6 foot apart. I don't want anyone to think that this says you don't need to remain 6 feet apart. That's not what I'm saying. But what I am saying is that it shows that wearing the mask is highly, highly effective. Today, the mayor reported double-digit deaths. Every one of those people who died from COVID-related illness, unfortunately and tragically, they were infected by somebody else, who was infected by somebody else, who was infected by somebody else. And somewhere along that chain of infections, this suggests that that would have stopped that chain of transmission. We would have had one less death. So, ladies and gentlemen, mask up. Thank you, Mayor.
Chief Pena.
Thank you, Mayor. We have one of our firefighters, Captain, who was in ICU, got a report late last night that he has taken a turn in the direction that we did not want him to take. He's been intubated. Captain Leroy Lucio, he's a 30-year veteran of the Houston Fire Department, works out of Kingwood Station. He is in ICU. I want to please ask the community their thoughts, prayers. Thanks, Mayor, for your support on this. It hits home. Okay, this is one of our own to make a full recovery, but prayers. we have firefighters are in quarantine. This is almost 50%, about a month ago, in the positive direction. Firefighters that currently tested positive for coronavirus, 3 in the hospital and 1 in ICU. In regards to our 69 complaints that were in the last 24 hours, we did not refer any business to TABC. Those that have been referred this weekend, it's the business community for a safe environment for our personnel. Wear your masks. Here has stated. Our country has the smart minds, medical and research minds, seen. But this advice we have for you: wear masks, help to spread this virus, because it's real. It doesn't feel it hits home. And urge people to do the right thing. I understand the impact that anxiety on the mask wearing, but as the mayor mentioned earlier, in compliance, we can get ahead of it and hopefully get back to normal, maybe even send our kids. Because I know parents, that's one of the things that at least me, I can't wait till I get my kids back in school. All of us doing this will help us there a lot. I may just take a few moments to relay just the heat index is triple digits right now. Please hydrated. Limit your physical activity to mornings or late afternoons. Please be aware of that you may have in the back seating. Look before you. 52 children died as a result. Please, please, please be cautious. Look behind at your pets, certainly, but you primarily are not left, or that your vehicles are left unlocked, where lock cells in there. It doesn't take you to strike. So that's.
I want to encourage people when wearing your mask, please do not hesitate. Any of the district council members, district at large council will have them available for you. Few reports of people dressed workers or cities attempting to gain people's homes. It has surrounding areas. Do not to sample water for COVID. Let me emphasize that. Cities are not knocking on any asking to be into your home to sample COVID-19. Are required to dispute when out in the field. Have questions about your water service, please call through easterntx.gov. There are no City of Houston in people's homes to test for COVID-19. Comes to your home, Houston, to test COVID-19. That is, do not allow them to enter your. I bring up a comment from you chart right back that we because I want to emphasize the again, since we started talking city from the first today, we have never reported our daily press conference. We have never done that. In March, April, or May, we may have 0, 1, sometimes got up to 4, and then we hit 8, 9, but day, July the 15th, 16th. For those virus a joke that is made up, not real, that isn't having an impact. Take a look at that chart. And frankly, equity within our city. 16 people have been permanently, and individuals that are on these persons did not have health conditions. And they are not real. We need to, and from the youngest, I'm asking people to exercise your own personal responsibility. Don't wait for the government. Don't wait for the government just now. Don't wait for and go to this particular this restaurant. Reality is that in our hands. Reduce these numbers that we are talking. The number of people that we have reported who have died in our city COVID-19. Then we have to mask. And quite frankly, we need about 90% compliance in our city in order to get the results that we are seeking. If you want to send your kids back to school in person, if you want to be on the football field, if you want to play soccer and all of these other things, if you want to be in the band and march in these bands, curricular activities, if you want to be in the stands, if you want the parades and all of these other things to take place, then what we do now in the month of July, heading into August, will be critically important. And so, again, I'm asking people in this city to take their destiny in their own hand. Let's do the right things. Now let me pause. It's from Sheila Jackson.
Thank you. So you can see, I'm wearing extremely seriously for steadfast leadership and all of the council members who have been in providing to this thing. And I to as well affirm the city's health, Stephen Williams, and of course I'll start where Chief Pena was and asked the city to continue the cabinet who is of course in a manner that warrants our deep. And also I think it is important that each level is an important means something to us, not one that we. It is evident that this is virus that is not a response of, and it does have it on Latin Americans, and so it's an impact on all ages. An important point that I also wanted to that I was with Second Superintendent, and she made her announcement, which is and it is important to make a point that we will not have funds when we return to back to pass providing about 100 to our schools and able to be reimbursed for all of the sanitize have to do. They had PPE, sir, and we were making sure that they are provided for as well. Mary, of the enormous expense, and in that ledger, which there will be upwards of $700 billion. Counties and local government are able to reimburse for all of the added expense. I think it is important to take note of two. I was Delighted Anthony Fauci over the weekend, and professionals joined him about where we are, that he is still a singular health professional of this nation because of the decades had. His recent vaccines will not be present late 2021. Who is indicated that most difficult times, with the coming and COVID-19, schools begin to open. That I think all of them, the circumstances and bus drivers and administering these children being in the school based on the Mayor Judge. And let me be very clear. There is no definitive science, but I've asked a number of in science that the susceptibility of children or their ability to affect is because there are one or two of evidences that we've seen involve children. So I think it is very important that we do, but that we realize that the science is still growing, being developed, as it is, and how we know that it's going to be more impactful, even more toward the fall with COVID-19. Mayor, I on you and thank you. Viewing the numbers in 10,500 COVID-19 are in hospital beds here. In addition, as we well know, because that we're in, have a department of team that I met yesterday will be in our hospitals, MCC. That doesn't come when you're just beginning of or downward trend of comes to a medical crisis. You have military personnel helping the enormous responsibility that I have, and I want to thank medical crisis and to give community, and we thank you for mass difference. But I want to particularly his recommendation of a two approach, maintain the United States Congress, a lot of federal funds here, the resource 19 to the city as I staff New York is now considering for individual companies and other voluntary act allow work at home to spread. It is extremely important we do so by as much as possible if we can provide by and I wanted to we the White House made education federal funds that are so desperately, such Title I funds for communities are continue to come. The school district to so very and uh, uh,
All right. Okay. So any people on your test routines that they found that would lab process results.
I should have, when I said real treatment, it was more than that. It was very negative. The lag, so being done, depending on where you go labs, the term 5 sites got one, but it doesn't testing, so we're going to be their contract, and we're here down day, and we've talked about reasons locally have national labs, so they're getting samples from across the nation. Two is the results are then to the CDC, who then gives it, whichever state it may be, that gives it to the local. They're very good about it very quickly. So between when I want to get CDC, I'm assuming the CDC with the CDC, I'm assuming they're getting it to the states where there is that chain of things down. My understanding, the national volume of tests in national labs is the big problem, and there's nothing that we can't out of our control.
I'm subbed for Dr. Purse. Is delay testing is the contract?
Unfortunately, I do. As you know, and as we've talked so many times, first of all, if you're going to get tested, people are going either when they have symptoms. In this case, if you have symptoms, you should, until proven otherwise, that you need to isolate yourself right then and result. Number two, people are going because they think that they may have someone who is a known case or someone else who they think may have been ill. For whatever reason that's the case, that you're getting tested, then you really need to quarantine. And then the third group of, right? Now that group, particular reason for are actively ill, need to quarantine. But the other two groups, those that have got symptoms and those assume until proven infected, they should quarantine. Who are in that group. So if that's the case, then that individual, if they're writing it, and again, remember, but number two, you think you're ill, you isolated home, and then back. What that tells you that the people who you notify them, they can do the same days to find out exposed 8-9 days ago, positive, or for whichever positive, they will have then, again, because of that, like, so your question, answer to a question is that yes, I do think it.
And this one's for you, Mayor. You can jump in. If you have suspected COVID deaths because the official numbers were ago, and what is the reality of the death situation? Skyrocketing and even mobile more realistic from two.
When we list the death, we also, yes, they're commonly behind. not really the physician or the part of the certificate. And there's by law that the other parts of the death certificate are filled out by the funeral director and the family. All three of those parts put together before it even gets submitted. Seeing the increase is that as we're being able to do the background work to catch up on this, and why we've the increased number. We record them based on the date. So there's a big jump. But this is just what we're listing. And we go back actually occur, but we're catching up. And my anticipation is that we may see a large number of deaths again tomorrow.
That one was from Channel 2. This one rates virus death rate so different from the 4.1% national.
Let me now, a large number of many because terrific going down the the second back now had the you still a grip of down the back. That's what having been said. It was supposed to does run the risk going up, but I believe in Houston's ability to repeat our performance and keep it down. And it is that I want to read in the hospitals who have learned a great deal about, and while and is out today we have nearly 800 intensive care units within Harris County, 1,800, 2,000 people in Harris County alone. It's like a lot of people that are in the hospital. The death rate, however, very, very low compared to the number of people, because we've learned a lot to treat more effectively. Colleagues in the hospital and are working very, very hard are actually doing them for contribution and keeping the death rate low. So they're keeping the job to keep the infection rate low.
Minister, in May, the people in this city did an excellent job. And so even when you the chart, and at some point the chart, the number that have tested positive per one in the country, highest. Chicago, okay, it's below all of them. In cases per 100 people tested positive. At the people who have died, Houston is 10. So we that have died. It's because in March, May, we did extremely good job at this virus. It's only opening up, and we open up, the numbers start to go up. Back and what we did, it's assessing.
This one's recovery rate. Why have covered in Houston out of the 31, and what is the average
Cases covered. We did a two-test method. Vast majority of people who can recover our method, which is 3 days of improving symptoms, whatever symptoms they may have. They have to be the 10th day, final day, 10 days from the beginning. That's how the majority of people, because that doesn't record it anywhere. Immediately they have a conversation with the physician, got to return to work, actually, logged anywhere, just true.
I think you might have touched on this one earlier about the other interpretations. This one show you the COVID positive cases or county.
So there's really three ways that about, and it's a great question. So thank you. People who died divided by the number of known. There is people who died divided. So you've heard that there may be 10 times as many people through testing as true cases. So one is called who died by the number of population deaths. Number of people the community. I like not the number, but you're going because that can that question.
From the pastor, what is
And commission. Number one, Spring Branch is doing a given choice, but they are situated now. And this school district, for starting 6, is going virtual. Pretty much for the entire month of August, these school districts are going. The governor's education, I think I'm going to be making an announcement as early as tomorrow, ending how long these school districts can receive funding.
Staying on the topic schools and the last one addressed earlier. It's an opening. What's your opinion on the decision?
Whether I agree with their opening up in their plan. I talked to well, the ones I've just mentioned. That have been laid out of the health concerns of their student members, the cafeteria workers, the bus drivers, their staff, and there also might we get this virus under canal. They in this sort of in person want to get into the importance of connectivity and the kids having. Because, I think what we understand in Cleveland now is that even in activity and device, so that our kids are not left behind. Can homeschool. Make sure that kids on the neighborhood or the zip code or the social economic facts. Even this week, we'll be making an announcement on, I think, over $1 billion that they have for move forward for connectivity. That announcement, I'm hoping, should come the next year or two. In addition, the city also so putting into an activity sorry, but, that there's the device in our so many.
Mention about the, like providing.
Actually, this is, there's a digital divide. And that is a glaring disparity helped in successful this kind
Want to make it larger or more educated, non-federal law is a penalty for how they are going to school conduct school COVID-19. The Congress intends federal dollars some of the and then direct the city for those that have basically no strings attached except for that the mayor has a essential workers and public keep working. It's Congress, and we want us point I would make, and I think percentage in a positive rate has and how we should act, and I guess I'm being some of the further encourage those who are home, but to self-quarantine. I think that's the challenge. Then, of course, one is our faith, and I hope that we will lean.
Thank you. Very well, yes, ma'am. Thanks. We're gonna need some assistance. Not that they need.
Everyone that this not that this back to
Do it. That's how your devices have to have it. So, and we'll get it done. Okay, hashtag accused.